Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
MS, or multiple sclerosis, is an autoimmune disease that targets the brain and spinal cord. It's today's Neighborhood Health Watch topic. Complications include paralysis, muscle stiffness, depression, and mental changes. MS can occur at any age, but it most commonly affects people between the ages of 15 and 60. This disease is challenging, but many people are able to work past their disease. Dr. Robert White with Chippenham-Johnston Willis Hospitals is here to talk more with us about it. What is the definition of MS, and why is it so painful and debilitating for people?
MS, as you said, is an autoimmune disorder, and it's a disorder in which our own immune cells attack the myelin sheath, our nerve fibers. Myelin is an insulation that insulates one axon from another, and our immune cells attack those axons and cause dysfunction. The dysfunction that's caused depends upon what those nerve fibers are responsible for.
There are some famous faces of MS, and they include, of course, Montel Williams and Richard Pryor, Annette Funicello. Why is it different for certain people? Some people seem to have a more severe form, and others seem to be able to get through it.
That's a great question, and the answer is no one knows. It's a very multifaceted disease with many faces, and we certainly have patients who seem to have a very benign form, and others who have a very aggressive form. But then I think about disorders like diabetes, and some folks have terrible complications while others not.
What about testing and diagnosis? Is there a test you can take to find out whether you have it?
MS is a clinical diagnosis, meaning that we don't have an equivalent of a pregnancy test. Yes, you do, no, you don't. Instead, we put a package together, and the package is the history that we get from our patients, our neurologic examination, spinal fluid examination, MRI scans. We put all that together to help us make the diagnosis.
And what about treatment? Talk briefly about how treatment has changed over the decades.
That's been the most exciting and fascinating part of this. Before 1993, there were really no treatments available except for when patients had acute attacks. In 1993, the first drug came out that we call a disease-modifying agent. From 93 to the present, we have now about 10 different drugs, all of which their purpose is to modify the pace of the disease. Unfortunately, we don't have a cure yet.
All right, Dr. Robert White, thank you so much for joining us for First at 4.